As higher learning institutions prepare to reopen after the lockdown, stakeholders within the sector want to fast-track efforts to protect students and staff against COVID-19. Government agency Higher Health has started to incorporate coronavirus-related content and training material that covers all 420 campuses in the public sector. This will entail, among others, peer education and student support services. So to tell us a little bit more, we are joined via Skype by Dr Ramneek Ahluwalia, who is both a physician and the CEO of Higher Health. Doctor, thank you very much for being with us here on Morning Live.
It's such an honor. Thank you, Leah. Thank you.
Before we get into the discussion on your plans, tell us a little bit more about the work that Higher Health does and its mandate.
So Higher Health, since last 20 years, South Africa has seen enormous, in fact, more than 20 years. So we are in existence for the last 20 years. And the epidemics like HIV, epidemics like gender-based violence, mental health, unplanned pregnancies, and many more, they affect young people, they affect our students. There's a lot of investment that goes into building a career, building a graduate competency, skills in our country for our next economy. If we lose our young people through these epidemics, and if we lose our young people not being competent or not becoming with the skills that our private sector, our government, or country is looking forward, we actually lose the whole thing of building the next generation of economy in this country. The economy actually comes from the post-school education training, from a TVET college where plumbers, miners, electricians, fishery industry, automobile industry, healthcare industry, universities where management, journalism, doctors, engineers, and everyone. So a formal workforce in South Africa depends on this sector. A hope of a mother depends on this sector. So the aim of Higher Health is to ensure that a student, not only when it's supported financially through NSFAS and many other spheres from the department perspective, but holistically, how can we ensure a student is able to graduate alive, skills being brought into the private and public sector. Yeah. And that's what matters to us the most.
Right.
And I think COVID-19 is bringing us another reality for us.
Yeah, and what a reality it is. It honestly is a massive reality check. But now, when higher institutions reopen, when higher learning institutions reopen, I should say, and no one knows when that is, how do you plan on communicating and driving education on campuses across the country?
Yeah, absolutely. To answer your question, as the global data is coming, there is no doubt that the elderly or people with comorbid conditions are very high in risk when it comes to severity of infections. But because this is a new virus, nobody has immunity to it. So everyone is susceptible to this infection. Youth will play a very central role in this infection. Now, why am I saying youth is because youth can be the biggest carriers of this virus. Youth are fragile. At this moment, they are sitting at homes, they are locked down, but they are itching towards, because they want to be mobile, they will not have severe infections, but they will be the carrier of this infection to the elderly, to people who will be living with comorbid conditions, or people who are immunocompromised. So the responsible youth is very critical. And as higher education, we've got enormous young people in the post-school education system. So how do we communicate to an educated young South African to not only become responsible, but also be capacitated to be able to communicate this to the other peers and to their families? So through what we're trying to do is at this moment, as we are locked down, we do not have access to our students. We're using mediums like our Vodafone. We partnered with Vodacom, MTN, and other cell phone partners to see how we can provide data-free capacity building through live webinars. Now, we partnered with NICD. We've developed a curriculum for young people, for our students. We've got an army that, because of HIV, because of gender-based violence and other epidemics, we always had this army of about 5,000 peer educators or foot soldiers that go through this curriculum and get capacitated. We're now tapping on to what we know best and saying how we can train them, even though we are locked down, so that when our institutions open, we already have a force ready to able to capacitate, because education is prevention. If we do not have treatment, we do not have means of fighting this epidemic, but what we have is the prevention methodology. And I think South Africa in the past has shown tremendous effort when it comes to prevention in terms of virus epidemics and stuff.
How are you communicating with students at this point in time during the lockdown?
So we've started a very immense communication campaign. We put a lot of investments on social media, on Facebook Live, on YouTube. We're putting investments towards SMS campaign. We've got database with all our universities, all our TVET colleges, through NISFAS, through NSF, and many other partners and CETAs. How can we bring all these database together and send authentic SMSs? Our campaign will be to fight myths, because the biggest challenge at this moment is the false information that's moving around. So how do we put scientific, authentic, easy information, easy to be understood by our youth and able to communicate? So SMS campaign, WhatsApp campaign, we're running a Facebook, a social media campaign. We're going to be coming through to ask SABC and reliable partners to come and say, how can we run public service announcements through you? Can we use your mediums to capacitate our young students more in terms of reaching out to parents, guardians, and students? So I really thank you for giving us this opportunity to be able to put this authentic information and asking our youth to become responsible. So and we've also got our campus radios and community radios, and we've got about 21 of them. So from today onwards, we're going to go live with content on regular training and capacity through these mechanisms.
That's fantastic. It really is. It's vitally important. So, you know, obviously there was not only the lockdown, but there was a case just before lockdown, unfortunately, where I think it was a Wit student that contracted the virus. What role did you play then?
See, the biggest challenge is, and this is going to be an example for many more universities that are coming. The reality is South Africa has to live with this virus till we find a vaccine or a cure in probably, and that's going to be for the whole world in practical reality. Now, there will be stages where we have to close down, we have to lock down. Now, a case like a Wits University is exactly what needs to be understood as an example of what needs to happen, because contact tracing, and that is what we have developed, a PSET guidelines. These post-school education training guidelines guides every institution and management of what to do if there is one case that becomes positive or a multiple cases becomes positive together in an institution. How do we go with contact tracing? We're putting additional nurses, we're putting additional campus healthcare workers, exactly how we did with contact tracing with Wits University. Trace every student who was in contact with the student who became positive. If you are susceptible or you are in contact with anyone who was with COVID-19 positive case, the aim is that we as a state can allow the person to be forcefully go into quarantine or self-isolation. We have to encourage people to go into self-isolation immediately. We have to call for temporary closures of our faculties, our disciplines, or the entire institutions at times if the cases will become more. And I think these are the guidelines that talk about. Guidelines that go as far as accommodation inside the campuses, because there are many students who cannot afford without not going home. They have to stay with our residences. How do we have mechanism or guidelines for our accommodation program? Accommodations outside our institution, which are private accommodations. How do we develop protocols, algorithms for them? Algorithms for our clinics, algorithms for our protocols for our student support. How do we react to even one case becoming positive, and how does that one case leads to contact tracing for others, and how does it impact the entire education system in general? So I think that's exactly how protocols, algorithms, and these guidelines will serve to support our management system to take appropriate, timely decisions so that we can react to this COVID-19. It's a difficult battle. Yeah,
it certainly is. But thanks so much for doing what you can to educate the youth. And of course, when it comes to higher education, that was the CEO of Higher Health, Dr Ramneek Ahluwalia, talking to us about the programs that they have in place in the higher education sector to protect students and staff from contracting COVID-19. All right, time now.